patient right now whose family is struggling with kind of just how rapid things have changed. And I think most people don't necessarily realize that having a diagnosis of dementia really kinds of in my mind, I picture it's almost like you're at the edge of a cliff. A very little wind
Right.
can just kind of push you over, and that frailty or that vulnerability is what makes dementia so distinctive than perhaps some of the other chronic illnesses. And, having diabetes most of the time doesn't make you so vulnerable that something a little bit will tip you over, but that is not the case
Right.
for dementia.
Well, you touched on a couple things there, and you talked about someone who's got like a mild dementia, then they come down with an illness like COVID, for instance, and they get really, really sick with it, and they have a hard time coming back. Unfortunately, I'll tell the family it's unlikely they'll ever come back to the level they were before they came down with that illness. And it's related to the illness itself, and as you know, the inflammation that it can trigger in the brain, which can cause more pathology and more damage to the brain. And in addition, we all have cognitive reserve. And so people can manage in a dementia with loss of short term memory, even with some impairment in executive function, yet still maintain reasonable social skills. So they keep up this facade that things are okay. And so then when they get sick and all of those defenses come down, that's when they fall off that cliff.
Exactly.